This is Dr. Barry Leica, host of Inside Cosmetic Surgery Today on webtalkradio.net, your inside source of information on cosmetic surgery, information you can really find nowhere else. Well, today we have an excellent guest by the name of Dr. Adam Schaffner, who works in the Manhattan area of New York City, and he is boarded in facial plastic surgery, so he's a very, very educated man. And today, Adam wants to talk to us a little bit about Facetime Facelifts. So, Adam, what do you mean by a Facetime facelift?
Well, Facetime facelifts are procedures which are performed to help people look and feel better about themselves. And the reason that they are coming in the first place is because of the fact they're noticing signs of facial aging, whether they be jowls or central neck fullness, bands in the neck region. Sometimes it's those folds that form between the corners of the nose and the corner of the mouth, or the parentheses, the bands around the mouth. And in doing so, we're able to tell patients that they have a variety of options to improve those, and one of which, in certain cases, is a facelift. But it's not always just a facelift. Sometimes we're able to help use substances to fill those areas, and sometimes we use other tools and technologies such as lasers or Botox to help.
Yeah, so again, I think the whole thing here is, from what I'm hearing, Adam, and correct me if I'm wrong, is that, what we're trying to offer to people is solutions for their problems. We're trying to offer them the answers for really what bothers them. When a person comes in to see me, they don't like the lines around their mouth, or they don't like the lines around their eyes. And the last thing they want is a facelift. They just want those lines to go away. So you and I have to really interpret their problems in ways that we really can make those problems into procedures that we can offer them and then explain the procedures to them.
That's exactly right. So it's an individualized approach for every patient. There is no standard one-size-fits-all, and it's really figuring out what is of concern to the patient and then offering potential solutions that can treat the problems that bother them.
Yeah, and I think that's the key. Now, what sort of patients do you tend to see in the New York area, and what sorts of procedures do you really love to do to help them?
Well, we see people of all ages, both genders. It is something where, of course, cosmetic procedures are more popular and more common with women, but we certainly see an increasing number of men who are interested in improving their appearance. Probably 10 to 15% of our patients are male, and we see people who are desiring rejuvenation of the face, breast, and body. And it's not always just rejuvenation. Sometimes it's people who want to change something about themselves, whether it's a man who has man boobs or gynecomastia. Some women want to enhance or lift or reduce the size of their breasts. Sometimes they want to remove some extra fat through liposuction. They want to help tighten the tummy region, especially after they've had children. And I personally enjoy all of those procedures because it helps people look and feel better about themselves.
Okay, let's go back to the facelift procedure. The facelift procedure is something that, all of us, I think, know about. But the problem in the old days of facelifts is they frequently were done in such a way that they left people looking rather abnormal. I mean, we literally yanked up the skin and sewed it into a position without taking into account everything else that was going on. Was this your perception of them done years ago as well?
Many years ago, that's correct. So in the 1960s and before, facelifts were primarily a skin operation. In the mid-1970s, there was a discovery that if you anchored the layer that overlies the facial muscles, that you're able to get a longer-lasting, more natural-appearing facelift result. and that was really a game changer. And then in the many years that followed between the mid-'70s and today, we have learned a tremendous amount about the structure and anatomy of the face. And in doing so, we have been able to significantly advance our abilities to provide a result that looks natural, that's long-lasting, and that is able to rejuvenate people in the way they were not previously able to do.
Yeah, and I think that's the key, and this is what I really want to emphasize for you, particularly, Adam, is that facelifts have changed. I mean, they totally are a different procedure than used to be done. People look much more natural with them. We can now do small facelifts. We can do large facelifts if necessary too. But I think it's important to realize that the procedure is put together for the patient, that one procedure does not fit all anymore. It really is a different way of doing things.
I would completely agree with that. It's an individualized approach, and when performing, say, a facelift, it's not just an isolated procedure. You can combine that with a neck lift. You can combine that with fat transfer. Very commonly, people will have volume loss, especially in the cheek region, the temple region. We're able to take fat from the body and transfer it up to the facial region to help provide volume that has been lost and provide a more youthful appearance. And it not only provides volume, but it also helps to restore skin quality and texture and tone in a way that we previously weren't able to see. So there have been a lot of advances. As you suggest, you can do many facelifts and get great results. And the old days of having a one-size-fits-all solution, I think, are finally gone by the wayside.
Yeah, and I think also what's happened quite logically, Adam, is our understanding of the face has really, really changed. I mean, in the old days, we thought mainly what was happening was a falling, that the skin was literally falling. We then started to realize that it's not just a falling, it really is a lack of volume that's going on.
That's exactly right. So three-dimensional planning, three-dimensional enhancement is really the cornerstone of a successful operation when rejuvenating the aging face. When people just took a two-dimensional approach and just pulled, it looked like they went through a wind tunnel. And you had the telltale swoop, almost like the Nike swoosh sign on the sides of the face. And with that, you could pick the people out a mile away who had a facelift. It didn't look natural, looked fake. Now, you would be hard-pressed to tell people who have had facelifts, they look great for their age. They look young, but you wouldn't be able to necessarily know that they had a facelift. And I think that's true of any plastic surgical procedure performed anywhere in the body, is that if you can't tell that it was done, that's good surgery.
Yeah, and I think that's the thing we want. And I think another thing that's happened over the years, and you can correct me if I'm wrong as well, Adam, is that I think most doctors are realizing less is more. We really don't have to do the overdone look anymore. We really don't have to carry everything to the nth degree. We really want to do things in such a way that it's a simpler procedure, and yet we don't have to carry things to the nth degree.
Completely agree. The enemy of good is better in certain cases, and certainly that's the case in this situation. I think that people, when they come to my office, have a few goals. They want to look better. They don't want to have complications. They want to have a short recovery time, and all of them say, but make sure I look natural. And when they say they want to look natural, it doesn't mean they want to look exactly the same as when they're standing before us that day before the procedure. Otherwise, they wouldn't want to have the procedure. But what they're really saying is, I don't want to look distorted. I don't want to look unnatural. I don't want to walk down the street and have people look at me because something is quote-unquote off. And so in doing so, the less is more is really more of a mantra to live by, and I completely agree with you that we're able to get excellent results without having to make them look overdone.
And I think the other thing that we've also tried to do is to help people get back to living quicker. I mean, it used to be that when we used to do a facelift years ago, a person had to hide away for an extended period of time. I mean, it took literally 6 weeks, 8 weeks for people to get back to their life, and they really had to hide away. You know, that's not my concept of plastic surgery now. My concept is something that people can get done and get back within a very short period of time.
Absolutely. You want to have rapid recovery procedures. You want to have people be able to resume their lives in as quick a period of as possible after the procedure. If people have significant downtime, it's going to really cause a problem potentially in their work life and in their personal life, and that's not what people want. People want to have the ability to go back to work, back to school, back to their personal lives, and not have the recovery period interfere with that.
Yeah, exactly. And the other thing that you said, and I'd like to reiterate that, is most people don't want to brag that they had a facelift done. They want to brag that they look better. They basically want to go about their activities, and they don't want people to come up and say, "What the heck happened to you?" They want to say, "Well, you know, you looked really good. Did you go on vacation? What are you doing?" You know, and if somebody wants to tell them they had a facelift, they can, but there's really no obligation to do so.
Absolutely. I mean, the majority of my patients don't even want anyone to know that they're in the office. They're coming in and out through a side entrance, especially after surgery. They don't want their photos anywhere on the website. They're happy with the results. They're happy they got it done. But this is something where they just want to look better. They want to feel good about themselves. Now, of course, there are certain people who are very proud of the fact that they've had the procedure and want to share it with all. But I think that what you're saying is that even whether they're people who are proud and want to share it with many, or people who want to keep it very confidential, that they all share the same goal, and that is to have quality results that looks natural but lets them look better than they would otherwise have looked at their stage of life.
Yeah, and I think that's where we're going to now is people can brag about things, they can talk about things if they want. If they don't want to, that's fine too. People can now have life-changing procedures that really don't have to be that contrasting. They really can feel better for themselves. And the number one reason that they're doing these things is really for themselves. It's not for anybody else these days. And, I think the reasons people are getting more plastic surgery and facial surgery done is because, first of all, it's safer. Second of all, it's more natural. Third of all, there's less downtime. And fourth of all, I think society itself wants people to look younger.
Absolutely. People have a desire to look as young and as refreshed and energetic on the outside as they feel on the inside. And when the external appearance doesn't reflect how they feel on the inside, it becomes a problem for the individual because they look in the mirror and they're impacted by the way they look. Moreover, in their personal and professional lives, looking tired or looking older than they feel can cause problems, whether it's competitiveness in the workplace, whether it is the ability to attract a significant other. There are potential consequences for looking older than you actually feel, or that you're actually at that stage of life. And that's why there's a chronologic age, and then there's a functional age. And you can't really do much about your actual age by your birth certificate, but you can do a whole bunch by exercising and dieting and eating right, in far as your health age. And you want to have your health age be as young as possible, and you want to look as young as possible to reflect how healthy and energetic you feel and are on the inside.
Yeah, I think those are all important concepts, and I think people have to take that all to heart in this day and age. Now, one thing I'd like to disparage the rumor of is that some people think all a person needs is a facelift to make them look better. You know, I get this quite often because I talk to people about Botox and fillers and other things, and they come in and they say, well, you know, I'm just going to get a facelift and it's going to last for the next 20 years. Is that a reality, Dr. Schaffner?
Well, unfortunately, in plastic surgery, we're only doctors. We're not magicians. And so as a result, we don't stop the hands of time. We don't stop gravity. And as a result, people will continue to age. And so the results will be very unlikely to last 20 years. And what patients really are asking when they say, how long is the result going to last? What they're really asking is, how long is it going to take for me to look the way I do now before surgery? And that's basically what they're asking. And it's going to vary for each individual depending on their genetics, their sun exposure, smoking and alcohol history, people who have had more exposure to hard living, if you will certainly age faster than those who have not. And one point that I do want to expound upon, which I know you brought up, which is I completely agree with, and that is multimodality therapy is really the key here. To say that just having surgery, just having a facelift is going to take care of the problems, I think is not the best way to approach it, but to say we're going to have, if you will, a team approach, a multimodality approach, where you're going to use things like Botox and fillers and lasers to complement the surgical result obtained by the facelift to make that result last as long as possible.
Yeah, and you know, I've always told, I quite frequently tell my patients is, you know, I used to think that doing cosmetic surgery was like doing baseball, and I used to think that the only way I could do baseball was to hit a home run every time. And as I've gotten older, I realized that it's much easier for me to get people on first base and then on to second base and then on to third base. And it wins more ball games that way, and it's more realistic that way than to really hit the home run procedure every time.
Well, I would agree. You definitely want it. Slow and steady does win the race. And if you try to swing for the rafters, you may hit the home run, but you can also strike out. So I think when dealing with surgery and healthcare, slow and steady is definitely the key to winning the race. Yeah,
and you know, I think most of us doctors that have been in business for a long time are more cautious these days. You know, we do get great procedures and we do get great results, and you know, our patients tend to put us on pedestals and tend to say we're gods, but we're human. You know, we do things, we do have complications, a dreaded word that I sure don't like to say, but it's something that happens. It's a reality. Anytime we do surgery, there are risks involved, and sometimes those risks manifest themselves as what we call complications, which is untoward effects. And a good doctor not only knows this, but he realizes this, and he helps people along through those procedures.
Absolutely correct. That's why before every procedure, no matter if it's just minimally invasive, non-invasive, or a full surgical procedure, I have an extensive discussion with every patient to discuss with them the potential complications and how we would handle them. And then, of course, they sign a document to reflect understanding of the things that took place during that discussion.
Yeah, and I think that's the reality of the situation is that, you know, overall, cosmetic surgery is amazing stuff, and facelifts are amazing, volume replacement is amazing, lasers are amazing, but you know, it really is something that we strive to get good at. And as I say, I practice medicine. I'm not an expert at medicine. I still am learning new things all the time, and the way I practice medicine now and surgery now is not the way I'll practice it in 10 years from now.
I would completely agree with that. So like any other field, medicine and healthcare and aesthetic medicine and surgery continue to evolve, continue to advance. And with these new developments, we're able to deliver better results in a shorter period of time with less downtime and less risk. And so therefore, I think all of our practices continue to evolve along that spectrum. But there are, you know, certainly key core principles that we all will abide by that are time-honored and will continue to apply decades from now, and that, of course, is putting the patient first, making sure that we're safe, that we do not do any harm, that we do things that are evidence-based, and that we are always acting in the best interest of the patient.
Absolutely. You know, and another thing we talked about, and I'll just mention it to our listeners, before we got on the air, we talked about how much interchange there is between the specialties now, and how plastic surgeons and facial plastic surgeons and dermatologists really have a lot to offer people, and by communicating between us, we really can make a better world for our patients. And that is, I think, one of the biggest things that's happening as a major trend in 2013 and beyond, is that more and more communication is coming about. Yes, there's still some turf protection going on. Yes, there's still doctors that badmouth other doctors. But overall, I see a rosier day where doctors are really trying to help each other and really trying to lessen the barriers between the specialties rather than to make them higher.
I would completely agree. The fact is that you learn more through different perspectives, and that's really obtained by different people from different disciplines analyzing the same problem and offering the solutions that they believe, based on their knowledge, training, and skill, would best help the patient. And when different people offer different solutions, they're sometimes bringing a perspective to the table that someone else from a different specialty, or maybe even their own specialty, may not have thought of on their own. And when doing so, potentially provide some enlightenment so that when that individual sees a similar situation in the future, they may be able to incorporate that perspective. And by combining different perspectives from different specialties, they can optimize a treatment plan for the patient and hopefully give them a better result than they would have to otherwise.
Yeah, I find, that although I'm a dermatologist, one of the limitations of my group is that we look at things in particular ways, and it really helps us to look at things from multiple ways in order to get the best results. Sometimes some of the best questions that have really helped to shape my knowledge were people questioning my knowledge and saying, how do you know that? How do you know that's going to be true? And that's certainly, I think, something that every good doctor isn't afraid of questions. He really is trying to do the ultimate for his patients.
Well, my patients ask those questions every day, and whether you're teaching someone who's in training or whether you're educating a patient, the fact is that any doctor, or for that matter, anybody who performs a task should be prepared to justify the reasons for the task, what the anticipated outcomes are, and what the potential risks are, and how to handle any potential complications. And once you're able to do that, you're able to make recommendations based on that knowledge that can provide a best possible treatment plan for the patient with the least possible risk.
Yes, and I think that's the best thing. And all of us as doctors, we have what I call a fiduciary trust, which really means that we have our patients' life in front of us. We have their whole well-being in front of us, and we really have to act on their behalf, and we have to take into account them as the number one thing that we have to do. We have to really work everything we have to make everything optimal for them.
Absolutely. The patients come first. You want to first do no harm. You want to make sure that whatever we're doing to help them has a very reasonable chance of achieving the goal for which the patient has originally set out to have the procedure. And if you know that that's the case, and that the treatment plan fits what the patient desires from a risk-reward profile perspective, from a downtime perspective, and from a financial perspective, I think that is something that is going to be in the best interest of the patient.
Okay, exactly. And, one thing about doctors, though, is we do disagree with each other. We don't always agree that one course is the best, and that sometimes is confusing to the patients.
Absolutely. So, they call it the practice of medicine because we're all still practicing. But the fact is that you can have a given problem and offer multiple valid solutions for that problem. And when the patient hears that there are multiple solutions, it can be confusing because without having the expert's knowledge and the contextual basis for that knowledge, it can be difficult to understand why doctors are offering different solutions for the same problem.
Yeah, and I think to the patients, in all respect, is each one of those doctors that offers a different position really has to be able to justify it. And I think that helps the patient to understand it, because then they can say, okay, I hear what you're saying, but I really don't want that because of this, this, and this. And
right.
And even if, as a doctor, even though I don't agree with it, I do accept that with patients, and I do accept that they have a right to take my to take what I have to say and reject it.
Absolutely. So, in the days in the past, it was more of a paternalistic approach where just trust me, I know what's best as the doctor, and we're going to do it that way. Now it's incumbent upon all of us as healthcare professionals to educate the patient regarding the issues at hand, provide them with the information so they can understand it, and ask questions based on that information. But ultimately, the final decision rests with the patient. The patient is still the boss.
Yeah, and ultimately they'll always be the boss because it's happening to them, and ultimately they have a right to decide and a right to really say what they want.
Absolutely, and that's why they call it informed consent, because you have to inform the patient before they consent to the procedure.
Yeah, exactly. So are there any final words you'd like to say, as we'll have to be wrapping up this conversation pretty soon? Is there anything that you'd like to say to people that are looking for cosmetic surgery, maybe to put them on the right track?
Well, I think that anyone who's interested in having any aesthetic procedure should do their homework, should take the time to learn about the options that are available to address the concerns that they have. I would recommend seeing at least 2, if not 3 physicians who specialize in the procedures in which they're interested in having. Make sure that the doctors are qualified to be performing those procedures, that they're trained in the appropriate disciplines, and that once you've gotten to that point, then I think it's important to speak to references, speak to patients on whom that doctor has performed the procedure that you're interested in having, look at before and after photographs to see whether or not you like the way that doctor has performed that procedure, because every doctor has an aesthetic eye of what they believe to be beautiful, and you want to make sure that their aesthetic eye is in line with what you believe to be beautiful. And then at that point, I think you have the knowledge that you need to be able to ask the questions that are necessary to be able to move forward to the next level and ultimately get the procedure that is going to help you.
Okay, Dr. Schaffner, before we wrap up, I always like to give our guests the opportunity to tell how our clients our listeners can get in touch with you. What's the best way to do so?
They can either go to my website, www.drschaffner, that's DRSCHAFFNER.com, and send us an email through the Contact Us page. The other alternative is that they can give us a call anytime at 212-688-6600. That's 212-688-6600, and be happy to answer any questions that your listeners may have.
I really enjoyed having you as a guest today, Dr. Schaffner, and I thank you so much for giving this time to educate the listeners out there and this opportunity for them to really learn more about the process of cosmetic surgery and really what might be best for them.
It's my pleasure. Thank you very much for the opportunity to be with you.
Thank you so much. I look forward to talking to you again.
Likewise.
Okay. This is Dr. Barry Leica, host of Inside Cosmetic Surgery Today on webtalkradio.net. your inside source of information on cosmetic surgery. As you're traveling around in the world and looking for new things and looking for things to make you better, be sure to check back often, as we have many delightful guests, people with a world of information that really can help you. And if you really would like to know how to choose a cosmetic surgeon, check to my website, Dr. Barry Lyka. That's www.barrylykamd.com. I've recently written a book called Don't Choose a Cosmetic Surgeon Without Me. It's just out, and people might want to check that out. I'd love to get you a copy. Have a great day. I really enjoyed talking to you today. Bye now.